Okay, hi. My name is Kathy Bayless, and I'm a UT Tyler student. I'm in the nursing program, the BS in nursing program. I'm 4th level. I graduate in just about 6 weeks on December 16th. If you haven't signed in on the sign-in paper by the door, could you please do that? By signing that piece of paper, you're agreeing to be a part of the study that's being done by UT Health Northeast. And what they're doing is they're doing a research study and an outreach program to provide information and education on colorectal cancer and the importance of screening. Sorry, I forgot my clicker. Okay. First off, the objectives of this is to tell about colon cancer facts, to explain what colon cancer is, how to reduce your risk for colon cancer, and colon cancer screening. I'm going to show you a very easy and simple way to get screened for colon cancer that you can do in the privacy of your own home, that takes away all of the problems with having to schedule a colonoscopy and go to the doctor and have somebody drive you and all that stuff. Okay. Did you know 1 in 3 adults are not getting screened for colon cancer? And by the way, colon cancer and colorectal cancer is the same thing. There's 137,000 new cases of colon cancer each year. And by getting screened, the goal is to reduce that number of new cases, because colon cancer is a very slow growing cancer, and if you get screened early and catch it early before it can develop into cancer, then no cancer. It's the most preventable cancer when caught early. Colon cancer facts. It's the second leading cause of cancer death in the United States for both men and women. Estimated in 2015, 49,000 people died of colon cancer. Colon cancer is not more predominantly in men, though that's kind of the way a lot of people believe. It's both men and women equally. Detecting colon cancer early increases your rate of survival. 90% of people live longer when their colon cancer is found early through testing. If it's found early, 90% live a lot longer. Colon cancer occurs in the colon, which is the large intestine. It's about 5 foot long. It's a muscular tube. It occurs usually down here in the colon and the rectum, usually pretty low. It may also be called colorectal cancer for that reason. It forms by first forming polyps. And whenever you get a colonoscopy, if you've ever had one, that's what the doctor is looking for, is polyps. And frequently they'll remove the polyps during the colonoscopy. But polyps start out, they're harmless. They're not cancer. And they're grape-like, non-cancerous growths. But over time, these polyps will develop into cancer, or can develop into cancer. It's not guaranteed, but it can. The cancer growth could spread to other regions of the body if it's left untreated. And 1 in 3 adults have polyps. One out of all, every third person in here has polyps right now. Usually there's no signs and symptoms of colon cancer until it's very advanced. So that's why a lot of people don't get screened for it, because they don't feel anything wrong. It's most common in men and women 55 years of age and older. For African Americans, they need to start get screening at 45 and over. As it progresses, you'll have weakness and fatigue, unintended weight loss, cramping or abdominal pain, and flatulence, which is one reason why people don't want to go to the doctor, because that's a little embarrassing. Signs and symptoms of it is rectal bleeding, dark stools, or blood in the stool. A change in bowel habits for more than a few days. That could mean you have diarrhea, or you get constipated, or a narrowing of the stool as if it's being squeezed tighter before it comes out so that it's narrow. 50 to 75 years old. I think I said 55, but it's 50 to 75. African Americans at 45. Both men and women. I've said all that. All racial and ethnic groups at any age could develop colon cancer. African Americans have a greater risk of being diagnosed and dying from it. There's an increased risk if you have a family history of polyps, if you have inflammatory bowel disease, or Crohn's disease. You can reduce your risk by eating healthy diet, rich in vegetables and fruit, healthy weight, be physically active and exercise at least 30 minutes a day, don't smoke, get screened once a year after the age of 50, and limit red meat, processed foods, and alcohol. Processed red meat like ham and salami and beef jerky, things like that, they have nitrates in them, which are put in the food to prevent food poisoning, botulism, but it can also increase your risk for colon cancer. But colon cancer is a lot less deadly than botulism. Recommended screening tests: a colonoscopy. You can have a high sensitivity fecal occult blood testing, high sensitivity guac test, or fecal immunochemical test. On a colonoscopy, they use a long, thin, flexible, lighted tube to check for polyps inside the rectum and inside the entire colon. During the test, you will be able to see, the doctor will be able to see and remove the polyps. You don't feel anything during the test. If polyps are found, they'll be sent to be tested for cancer. You should have a colonoscopy every 10 years. And then there's two types of blood tests. The one that I'm going to give you or recommend today is the FIT test. The first test, though, is guac test. It's the most common type used in the United States, but you need to have you have to take 3 specimens from 3 different bowel movements. It's non-specific, and the results can be influenced by what you eat and by certain medications. It's better sensitivity with the newer versions, and you do it 1 time a year. The FIT test, which is I'm going to tell you about today, is specific for human blood. It is not influenced by food or your medication. And the results, and some types require only 1 or 2 stool specimens. Okay, and the FIT test is, I'm going to show it to you. If you fill out all the information, and if you have no insurance or you're underinsured, you will be sent a FIT test in the mail. If you have good insurance and you don't qualify, then you can request a FIT test from your doctor, and of course your insurance will pay for it. Excuse me. You'll get in the mail an envelope, and inside it has instructions. And it comes with 2 of these. It's a long piece of paper. It's got tape here and tape here. You put it on your toilet seat, tape it down, and then you're going to sit over it when you have to have a bowel movement. After you have your bowel movement and it's caught on top of the paper, you take the little tube that's in the package, excuse me, you pull this out. In your stool, you'll punch it 3 or 4 times and just kind of twist as you do to get samples from at least, 4 or 5 different locations. Then you put it back in the tube, close it up, drop it inside this little envelope that comes in here. Leave the paper in, that helps to keep the moisture out. Drop it in there, then put it in the envelope. And if I understand right, it's going to come pre-addressed and stamped and everything, and then just drop it in the mail. And if at the laboratory, it'll be sent to a GI laboratory with UT Health Northeast, and if it comes back positive for blood, that means that you don't necessarily have colon cancer. You could have just polyps. You could have hemorrhoids. You could have something else. But if it comes back positive for blood, they will give you a call, and then you can go in and schedule a colonoscopy. If you have no insurance or you're underinsured, it's free. If you have insurance, your insurance will pay for it. It's totally private. It takes away all of the hardship of having to go to the doctor, schedule a colonoscopy, then drink that really gross solution and flush your system out, and then go in, get somebody to drive you, have the colonoscopy, wait till you come awake, and get somebody to drive you home. You'll have to take off work if you work. It's very time consuming. This is a very simple pre-screening. And then if this comes back negative, then you know you're good for a year. You don't have to do anything else for a year unless you start having signs and symptoms. If it comes back positive, then you can schedule a colonoscopy and make sure, or determine what was causing the bleeding. If it's polyps, doctor can remove the polyps, and you won't have to worry about the polyps turning into cancer. Are there any questions or comments, or anybody want to share stories? I have a post-test for you to fill out. The first part is like the pre-test. This is much shorter. You just put your name up at the top, answer the questions, and I'll take those up. And if you have any questions, just let me know. Call your doctor if you have any questions about the fit test. He will know what it is if you just say, I want to ask you about the fit test. And make sure you sign the sign-in sheet and did your pre-test. Thank you all very much.